Hi, welcome. My name is Mina, and this video is a quick morning tune-up for anyone with lower back pain due to lordosis. So that's extreme curvature in your lower back. Um, Back pain can have many causes, but this video is specifically for those people who have tightness in the lower back due to also inactive or underactive other areas of the body, such as the glutes or the core. And so we're predisposing the body for better alignment in the morning so that we can go through the day accumulating better habits. Even sometimes we go through yoga and we find these movement habits or alignment habits that are actually making both back pain as well as yoga butt worse. So that's where the hamstrings are overstretched, and you might even get some pain in the area of your buttocks. So we'll try to combat both of those things at the same time. You need a block, and we'll get started lying on our backs. So we're going to come into constructive rest position. So just for a moment, feet hip width distance apart, and just finding a position where your legs have to do relatively little. Sometimes it takes a while to wiggle the feet in a way to find the position. You can also bring your hands onto your groins. Just a moment to arrive here. And so when we stand with sort of a crunched lower back, this area through the fronts of the hips gets short as well. So in everything that we're doing today, we're moving with a sense of length and spaciousness through the fronts of the hips as well. Good. Let's take another deep breath in. And deep breath out. Good. Let's take the block and we're going to squeeze it in between the thighs. This one's relatively thick, but I'll still go second width, depending on your bone structure. You might have to see which width feels steady for you. And we'll just start to tilt the pelvis. So first inhale. And as you exhale, you can squeeze the block between the thighs. Just do this a few times. Inhale. It's activating through the inner thighs a bit. Exhale to squeeze. As you inhale, you can relax and you can allow your pelvis to tilt a little bit posteriorly. And as you exhale, you can squeeze the block and help the pelvis tilt anteriorly. Let's do this a few times. Inhale. What I mean by that, the hip bones will pop up, the sits bones will point down. As we inhale, the belly gets soft. And as you exhale, you can squeeze the block, squeeze your bum a little bit, and the pelvic bones start to move up towards the rib cage, and your lower back starts to flatten. Let's do this a few more times. Inhale. Basically like a cat-cow on your back. Staying nicely grounded through the feet. Inhale. And exhale. This time we're going to stay in this position that you created in exhale. There's a gentle hollowing feeling through the belly and a length through the tailbone. Keeping that position, we're going to lift the hips. Good. Doesn't have to be 100% intensity. You're just starting to lift the hip. Maybe, 5 centimeters off of the floor. Good. And point is we're trying to keep the sense of the pubic bones, not the pubic bone moving towards the belly button, as well as the hip bones moving in towards the rib cage. And quite often when yoga, we move into a bridge pose, we sort of open from the rib cage. This space gets short, and we're arching more in the upper back than trying to create space through the hip flexors. So again, I'm squeezing the block, I'm squeezing the glutes slightly, I'm creating space here, and I'm hugging in through the rib cage. Good. I'm going to stay there for just a little while. Hopefully you feel your bum getting warmer, your inner thighs are still squeezing in, and you're trying to repattern this body, pubic bone towards belly button, hip bones in towards the rib cage. Take another breath in. And as you exhale, you can slowly release. Let's get the block out for a moment, and we'll take a super easy twist, bringing the knees in. Maybe you want to draw some circles. And then when you're ready, you can bring your knees over towards the right side. Easy supine twist. If your head wants to go with, go ahead. And really breathing into the rib cage here for a moment. Might feel a bit stiff in the morning, that's perfectly fine. And the more movement we have in the thoracic spine, that's in the rib cage area, and the more freedom we can also have in the lower back. Quite often, it's a tight rib cage that influences itself sort of negatively into the lower back. One more breath in and breath out. Let's come through center, inhale, and then exhale, twisting over to the other side. Good. Taking a few breaths here. That's my quote-unquote tight side. Just breathing into whatever it is that you're feeling through the ribs, the armpits, outer hips. And if your head wants to go with, let it go with. 2 more deep breaths. Last one. Good, and then we'll slowly come to center. And then we'll do one more glute bridge. This time a little bit different. You can take the block between the soles of your feet and then place it onto the ground. The outer edges of my feet are in the ground, and I also have the block as a reference, something I can press into. I'm going to start the same way here. Now the knees are open. You can bring them lower down. You can bring them less low down. It doesn't really matter. See where you find a sense that you can really press into the blocks. And I'm already starting to feel my glutes. This time slightly obviously in a different position because the hips are open. I'm just starting with inhale, like cat and cow. And as you exhale, squeeze the blocks, squeeze the glutes, and then finding a bit more space for the fronts of the hips and closeness between the rib cage and the hip bones. A few more times. Inhale. And as you exhale, squeeze. Last one. Inhale. Can allow a bit of an arch. Your lower back and off of the ground. And as you exhale, thinking about pushing the lower back into the floor, pubic bone towards belly button. Keeping this, I'm going to lift my hips up. Okay, I'm going to hang out here for a moment. Slightly different position. Again, the knees are open. I'm pressing into the floor through the outer edges of the feet. Here again, I can sort of open my rib cage, let my bum hang, let the front of the hips shorten, but I'm not doing that. I'm squeezing my bum. I'm hugging in through the rib cage so that not my whole rib cage is on the floor, but a little bit more, and I'm opening through the hips. Good. You can stay here and breathe, or you can cactus or robot your arms so that the elbows are pressing down. This will give you a little bit more stability. See if I can transfer the weight into the left outer edge of the foot. Now my hamstrings also have to work to pick up my right foot. Inhale. And as you exhale, you can bring it down. This is really, really hard for me, especially on the left side. And in my case, one hip tends to dip. So I want to counter that. I want to keep both hips high. It might take a few tries for your body to be like, how am I supposed to activate here in this position to make one foot lighter? Maybe 2 to 3 rounds. Good. Keep on breathing. And then coming back. Squeezing the block. Obviously lost quite a bit of this tilt in doing this. I'm still learning. And slowly release. You can widen the feet. Let the knees drop in. And just come into internal rotation as opposed to external rotation where we've just been. Okay. You can also windshield wiper the knees. Release. Good. And then we'll come up to sitting through the side. Let's come into a cross-legged seat. We'll change the position of the legs in a moment. If you want to sit up on a blanket, on something, because you feel like you're rolling back, go ahead, do that. Just mobilize the spine a bit. Inhale. Exhale, up and over. Good. We can stay here, or you can cactus the arm. Inhale. And as you exhale, round diagonally forward. Keep the sit bones down, and this will help you to open through the backs of the hips. Inhale. And exhale a few more times at your own pace. And in this video, we're mostly focusing on activating the areas that are weak, but also obviously feels nice to open up some of those tight areas. Inhale, coming back to center. Exhale up and over to the other side. Inhale to cactus the arm. Exhale, round and a little bit diagonally forward. You'll feel where it feels nice and juicy. Inhale. Exhale, belly button pulls in towards the spine. Good. Last one. Inhale. And exhale. Good. Inhale back to center. And then exhale, you can fold. And you don't have to be super open through the hard fold with a long spine. You can think about really grounding through the sits bones, pulling the belly button in, closing the ribs so that you really get that space through this fascia here. This is the thoracolumbar fascia, and it's really just one huge piece of fascia, and it takes time to slowly open that space up. Good. We'll slowly come back up, and then we'll switch the legs. We'll take a twist this time. Inhale, reach up. And then exhale, twisting to one side. Good. You can use your fingertips behind you. And some of us who are chronically tight in the lower back, we're really arched here when we twist. Think about leaning back a little bit, belly button towards the spine, hugging the ribs in, so you're actually stacked on top of the hips as you twist. Head can stay sort of neutral, or you can roll your back shoulder up, back and down, and then really encourage this opening through the chest. And then we'll inhale back to center. Exhale, twisting to the other side. Good. And again, noticing where your weight is at on your hip bones, and then really feeling the weight sort of dropping into the sits bones as you slowly twist. You can use your hands. No need to force anything. And then again, you can roll the shoulder that's sort of leading the twist up, back, and down, allowing this movement of the shoulder blade. And if you want to incorporate the neck, go ahead and do that. One more breath in and breath out. Inhale back to center. And this time with this variation of the legs crossed, folding forward one more time. And finding this right balance between length through the front of the heart and also grounding through the sits bones, which will help you to create more space through the lower back. I'm really thinking about even pushing the hands down and forward to roll the sits bones back. Good. And then you can slowly come back, and we'll get into a tabletop position from there. And then let's take a few cat and cow here. If you need a blanket underneath knees, go ahead, spreading the fingers. And as you inhale, you can open the heart. And as opposed to really dumping here or moving through the pelvis, you can keep the pelvis relatively neutral, but really think about pulling the hands back to open the heart, open through the collarbones. As you exhale, really rounding. And here, remembering what we did at the beginning of the class, you can even get the block between the thighs as a reminder. Squeeze through the inner thighs, squeezing the glutes and opening space through the fronts of the hips. Might look a slightly different than your usual cat and cow, but we're trying to wake up the glutes and create space to the lower back. Inhale, can be soft, more through the heart than through the lower back. And as you exhale, push the earth away. You can press the toes into the ground, squeeze the block, squeeze the glutes, and really create space through the fronts of the hips. A few more times. Inhale. Exhale, squeeze. I'm almost trying to bring the fronts of the hips towards the backs of my wrists. Last one. Inhale. And exhale. Good. Let's keep the block if you have it. Keeping the sort of squeeze through the glutes, openness to the fronts of the hips. You can tuck the toes under and come into a plank pose. Good. My plank pose isn't perfect either, but it's not where I used to. So a lot of people have this. The shoulders are back, the bum is up. And so again, we're squeezing the block, squeezing the glutes, creating space through the fronts of the hips, and also hugging in through the rib cage. Take another breath in, breath out, inhale, and then exhale. Let's come down onto the belly, either knees, chest, and chin, or in one piece. Good. We're going to go into cobra, but again, same idea. Hands underneath the shoulders, feet super active, especially pinky toes pressing down. And as opposed to letting my butt pop and sort of coming up, I'm squeezing my glutes, pressing the pubic bone into the earth so that my lower back is wide open. Maybe your cobra is down here. That's perfectly fine. And again, the emphasis, space in the lower back, openness through the heart. Good. Inhale. And exhale. Good. Let's come down and then press back into a downward facing dog. You can slowly move into your first down dog. And hopefully there is no compression in the lower back, so down dog feels nice. You can sway, you can bend the knees, whatever you need to do to come into your first down dog of the day. Maybe your knees are soft, maybe your feet are a little bit wider than hip width, and if your wrists need a little help, you can also turn them out, see what feels right for you today. Let's deepen our down dog a little bit. You can come up onto the heels, you can bend your knees, and then send your sits bones up and back like your hips are getting abducted. And we're creating the spaciousness through the inside of the body. And I'm not hanging here. Again, this is what sort of shorten the lower back. I'm lifting in and up. From there, see if you can extend through the backs of the knees. And the last thing to lower are the heels if they lower at all. Hugging the ribs in slightly if you have a tendency to just pop open here. Another breath in and breath out. Good, let's walk the hands towards the feet to come into a forward fold. Feet can stay as wide as they are, hip width or even mat width if your the backs of the legs are a little bit tight. So the glutes might be weak and your hamstrings might be tight. That might also be sort of a correlation in this whole lower back situation. If you need to bend your knees, go ahead, letting the head hang for a moment. Good. So my rounding in the lower back, still, I'm working on it. It's not really there yet, but it's gotten better. So there is, you can create changes in your body over time. You have to be a little bit patient. We're going to inhale, halfway lift. If the fingers stay down or come onto the shins, doesn't really matter. We're going to lengthen. And then as you exhale, really pulling the belly button in, rib cage in to fold. We'll do this a few more times. Inhale, halfway lift. And as you exhale, again, rib cage in, belly button in, broadness through the lower back as well as through the backs of the legs. One more time. Inhale. And exhale. Good. Let's walk forward again into plank. Inhale. Let's just hold the plank for a moment, this time without the block. Maybe you want to bring the feet a little bit closer. Imaginary block, squeezing it. Glutes start to squeeze. The fronts of the hips start to get nice and long. Rib cage hugging in. Another 5, 4, 3, 2, and 1. Good. You can lower your knees and you can sit down onto your heels for a moment. If sitting on your heels is not your thing, you can always sit up on a block or two. Good. So we've been activating our hips. Let's also get in some alignment through the rib cage. So let's interlace the fingers, palms facing forward and up. Good. So for most of us, I'm going to show from the side. If you reach the arms up because the shoulders are tight, we sort of start to move from the rib cage once the shoulders come up. But we want, again, the tailbone to move down, belly button to move in, rib cage to suck in so that the movement is really coming from the shoulders. And we're just going to hang out here for a moment, thinking about using your own inner musculature to lengthen, create space through the body. Another breath in. And as you exhale, release. We're just going to switch the interlace, palms facing forward and up. Inhale. And as you exhale, again, sit bones heavy, rib cage towards the back. And thinking about creating space equally through the front, sides, and the back of the body. The back of the body tends to get short. That's our problem. So lengthening the back of the body, opening through the shoulders. See if you can extend through the elbows. Inhale. As you exhale, release. Good. Let's keep that in mind as we come into bird dog. Grounding the hands. And then let's point the right toes back in space. And here already, we tend to often be here hanging in our joints. So use this toe to press into the earth. And we don't have the block to squeeze, but you're still squeezing your block. From there, also hugging the rib cage in and then lifting the leg. If I lift my leg this way, it's unsatisfyingly low. But this is sort of the maximum I can go with my glute strength. If, of course, I let my rib cage go, I can do this. But that's not what we want. We want sort of a containment through the front of the body, length through the front of the hip, and then sort of this activity through the glute area. Take another deep breath in. If you want to extend the left fingertips forward, and this is the moment when we sort of let things go again, hugging in. And breathing here for another 5. 4, squeezing into the center as well. 2. And 1. Good. Release. Other side. Left toes move away. Press the earth away, hugging in. And then from there, dissatisfyingly low left leg, and that's perfectly fine. I'm not lifting the leg for the sake of height. I'm lifting and making these movements so I can create space in the lower back, create space in the front of the hip, and find this containment and alignment that carries me through the day. Okay. And then reach long, hug into center. Another 4. 3, a little bit of shaking. Keep on breathing. 2. And 1. Good. Both feet. Both knees, both hands down to the floor. Inhale, lift the heart. And then exhale into a child's pose for a moment. Again, child's pose, the same thing. Sometimes people have their knees open and they're in a child's pose like this. Might be sort of a puppy pose shoulder opener, but see if you can bring the knees a little bit closer. They don't have to be super close. Some hips just don't like it. And you can, again, like in the forward fold, use the fingertips to round back, belly button towards the spine. And really encouraging this roundness. You can also bring your arms behind you. Deep breath in. Deep breath out. Good. All right. And then you can slowly come up to sitting. And sitting upright any way you like. And again, just noticing where your body is stacked. And if you're already arching here, see if you can pull it back, lean into your own back body. And if you like, you can place your hands together in front of the heart. And see if you can find something that you'd like to carry into the day. And I thank you for sharing this little morning practice. Hope you have a wonderful day.